If you or someone you love has ever had chest pain, pressure, or shortness of breath, this might be the most important 30 seconds you ever watch. Your left arm starts tingling, you break into a cold sweat, and the terrifying realization hits you. You might be having a heart attack. Every year, thousands survive the first few minutes of a heart attack, but lose their life in the hours that follow, not because help wasn't available, but because they didn't know what to do next. In this video, I'll walk you through 5 crucial actions you must take immediately after a heart attack to protect your heart, your brain, and your future. These are the same steps doctors wish every patient knew, and they could be the difference between recovery and tragedy. What you do in the next 60 seconds could literally be the difference between life and death. And most people get it completely wrong. The content you are about to see, although extremely helpful, is for entertainment and educational purposes only, and never replace your doctor's recommendations. This should act as a fundamental guide to what you should discuss with your trained medical professional. This is not medical advice and should not be treated as such, but I am going to share 5 critical actions that could save your life when you're facing a heart attack alone. But first, let me tell you about Sarah. She was a 52-year-old teacher who thought she was just having indigestion after lunch. She decided to lie down and wait it out. Big mistake. By the time her husband found her 3 hours later, permanent damage had already been done to her heart muscle. Don't be like Sarah. Every year, over 800,000 Americans have heart attacks, and about 25% of those happen when the person is completely alone. The survival rate drops dramatically when you don't take immediate action. But here's what most people don't know. There are specific steps you can take, even when you're by yourself, that can dramatically increase your chances of survival and recovery. Subscribe to the channel for more valuable insights. Before we dive into these life-saving actions, I need you to understand something crucial. Time is literally part of the heart muscle. Every minute that passes during a heart attack, more of your heart tissue dies from lack of oxygen. Medical professionals call this time is muscle because the longer you wait, the more permanent damage occurs. This isn't about being tough or waiting it out. This is about survival. Action number 1, and this is absolutely critical, call 911 immediately. Not in 5 minutes, not after you try to drive yourself to the hospital, not after you call your spouse or your doctor. Right now. Pick up your phone and dial 911 before you do anything else. Here's why this is so important. Emergency medical services can start treating you the moment they arrive. They have medications, oxygen, and equipment that can literally restart your heart if it stops. Plus, they can get you to the hospital faster and safer than you ever could driving yourself. But here's something most people don't know. When you call 911, don't just say you think you're having a heart attack and hang up. Stay on the line. The dispatcher is trained to guide you through this emergency and can provide life-saving instructions while help is on the way. They might tell you to unlock your front door so paramedics can get in, or they might walk you through specific breathing techniques. Follow their instructions exactly. And here's a crucial detail. If you live in an apartment or complex building, make sure you tell the dispatcher your exact apartment number and any access codes they'll need. Time wasted looking for you is heart muscle lost forever. Action number 2 might surprise you. Take aspirin, butane if you're not allergic, and don't have any bleeding disorders. Chew 1 regular strength aspirin, about 325 milligrams, or 4 baby aspirins if that's what you have. Don't swallow it whole. Chewing gets it into your bloodstream faster. The aspirin helps thin your blood and can reduce the size of clots that might be blocking your coronary arteries. But let me be crystal clear about this. Aspirin is not a cure. It's a stopgap measure while you wait for professional medical help. Some people think taking aspirin means they can skip calling 911. That's deadly thinking. The aspirin might buy you some time, but you still need emergency medical treatment immediately. Also, if you're already on blood thinners like warfarin, or if you have a history of stomach bleeding, skip the aspirin. The risks outweigh the benefits in those cases. When in doubt, ask the 911 dispatcher. They can guide you on whether aspirin is safe for your specific situation. Action number 3 is about positioning, and this could save your life. Sit down immediately, preferably in a chair with good back support, and stay calm. Do not lie down flat unless you're told to by the 911 dispatcher. Here's why. Sitting upright helps your heart pump more effectively and makes it easier for you to breathe. Lying flat can actually make things worse by increasing the workload on your already struggling heart. If you start feeling dizzy or faint, then you can lie down, but prop your legs up on pillows or a coffee table to help blood flow back to your heart and brain. The key is to find a position where you can breathe easily and feel as stable as possible. And whatever you do, don't pace around or try to walk it off. I know the anxiety makes you want to move, but physical activity during a heart attack puts additional strain on your heart when it's already in crisis. Save your energy for staying conscious and alert for the paramedics. Action number 4 is something that could literally restart your heart. Prepare for the possibility of cardiac arrest. Now, I'm not trying to scare you more than you already are, but about 10% of heart attacks lead to cardiac arrest, where your heart stops beating effectively. If this happens and you're alone, you have very limited options, but there are still things you can do. First, if you have an automated external defibrillator, or AED, in your home, make sure you know where it is and how to use it. These devices are becoming more common in homes, especially for people with known heart conditions. If you don't have one but you're at high risk for heart attacks, consider getting one. They can literally shock your heart back into a normal rhythm. But here's something most people don't know. There's a technique called cough CPR that might help if you feel like you're about to lose consciousness. If you feel your heart stopping or beating irregularly, cough hard and deep every few seconds. The pressure changes in your chest from coughing can sometimes help maintain blood flow to your brain and keep you conscious until help arrives. But remember, this is not a substitute for real CPR. It's just a desperate measure when you're alone and feel yourself losing consciousness. Action number 5, and this one is crucial for the paramedics. Gather your medical information quickly. If you're still coherent and have a few minutes before help arrives, grab a list of your current medications, especially if you take blood thinners, blood pressure medications, or have any drug allergies. Put this information where the paramedics can easily see it, like on your kitchen counter or coffee table. Also, if you have any medical alert bracelets or medical IDs on your phone, make sure they're visible and accessible. Paramedics need to know about conditions like diabetes, previous heart attacks, or recent surgeries because these affect how they'll treat you. Here's something that could save precious time. If you keep a medical information sheet on your refrigerator or in your wallet, tell the 911 dispatcher where it is. Many people don't know that paramedics are trained to look in specific places for medical information, and having it readily available can speed up your treatment significantly. Now, let me tell you what not to do, because these mistakes kill people. Never, ever try to drive yourself to the hospital during a heart attack. You could lose consciousness behind the wheel and kill yourself or innocent people. Plus, ambulances can run red lights and get you to the hospital much faster than you can drive yourself. Don't take nitroglycerin unless it's been prescribed to you and you've taken it before. While nitroglycerin can help some heart conditions, It can be dangerous during certain types of heart attacks, especially if your blood pressure drops too low. Don't drink water or eat anything. If you need emergency surgery, having food or liquid in your stomach could cause serious complications with anesthesia. And please, don't try to contact everyone in your phone before calling 911. I understand the urge to call your spouse or children, but every second counts. Call 911 first, then you can make other calls while you wait for help to arrive. Here's something that might save your life in the future. Learn to recognize the warning signs before they become to the full heart attack. Many people experience symptoms days or even weeks before a major heart attack. These can include unusual fatigue, shortness of breath with normal activities, chest discomfort that comes and goes, or discomfort in your jaw, neck, or arms. Don't ignore these warning signs. See a doctor immediately. Also, know your risk factors. High blood pressure, high cholesterol, diabetes, smoking, family history, and being overweight all increase your heart attack risk. If you have multiple risk factors, talk to your doctor about an emergency action plan and consider keeping aspirin and emergency contact information easily accessible in your home. Let me share one more story that illustrates why this matters. My neighbor Jim felt chest pain while working in his garage one Saturday morning. Instead of calling 911, he decided to finish his project and see if the pain went away. 3 hours later, his wife found him collapsed. He survived, but the delay caused so much heart damage that he now needs a heart transplant. 3 hours of denial cost him his quality of life. The bottom line is this: when it comes to heart attacks, there are no second chances to get it right. Your heart doesn't care if you're embarrassed about calling 911 for what might be nothing. It doesn't care if you don't want to bother anyone or if you think you're tough enough to handle it alone. Your heart muscle is dying, and only immediate medical intervention can save it. Remember these 5 actions. Call 911 immediately. Chew aspirin if it's safe for you. Sit upright and stay calm. Prepare for cardiac arrest if you're at risk, and gather your medical information for paramedics. These steps, done quickly and in order, can mean the difference between a full recovery and permanent disability or death. If this video helped you understand what to do during a heart emergency, please share it with your family and friends. You might literally save someone's life by sharing this information. And if you want more life-saving health tips, make sure to subscribe and hit the notification bell so you never miss important information that could help you or someone you love in an emergency. Remember, being prepared isn't being paranoid, it's being smart. Your life is worth those few minutes of preparation and knowledge.